We start with the pandemic. A tally by Reuters shows the global death toll has topped 5 million as the Delta variant spreads. Over half of them were reported in the United States, Russia, Brazil, Mexico and India. The US has recorded the world's largest death toll of more than 700,000. It's also reported that the first 2.5 million global deaths were recorded in over a year, while it took just under 8 months to bring the number to 5 million. The world saw a daily average of 8,000 deaths since the 7 days that ended on Friday. That's about 5 deaths every minute. But the rate has slowed down in recent weeks. There are more efforts to provide vaccines for poorer nations, even as richer ones have begun offering booster shots. Still, over half of the world has yet to receive a first dose. Singapore has returned to tighter curbs after seeing record daily infections of COVID-19. The city-state is reviewing how to simplify its virus protocols and stepping up testing. It reported its highest single-day spike on Friday with nearly 3,000 cases. A recent surge has caused Singapore to suspend further reopening. The country began to ease restrictions in August. More than 80% of the population has been vaccinated. Australia reported more than 1,900 new cases of the Delta variant on Sunday. The push to vaccinate continues to end lockdowns and allow for the reopening of international borders. For more on the situation there, let's cross live to our correspondent Greg Navarro in Sydney. Greg, tell us more about plan to lift the restrictions despite new infections getting more and more every day.
Well, we could start here in the Greater Sydney region. This is our 100th day in lockdown since the start of this current Delta outbreak. I can tell you from personal experience, it is a very long time to face these very severe restrictions. Obviously, they are necessary from the health perspective and according to health officials here. There are some very positive signs, though, in the number of daily cases today within the last 24 hours, just over 650. Compare that to 3 weeks ago when it was more than 1,500 in a 24-hour period. So certainly vaccination rates as they increase are playing a role, and that's something health officials are very happy with in this state. The state of Victoria and Melbourne in particular still heading in the opposite direction. Case numbers there are climbing. They're well over 1,000 a day. But vaccination rates are also improving, and they do expect to see the benefits of that very shortly as well. Now, both state and government plans to open up, to get rid of restrictions, get rid of lockdowns, open borders, still going ahead, predicated on those 70 and 80% vaccination rates. And that is something that here in New South Wales, for example, we are approaching very rapidly as well. We've been told, in fact, here in Sydney to expect case numbers to skyrocket once the lockdown has been lifted. Health officials, though, are hoping that happens among the vaccinated rather than the unvaccinated. The theory being that the vaccines that we are using here in Australia are very effective at preventing serious illness and death as well, and that is something that they said brace ourselves for here. As far as opening international borders, the government's plan that was announced last week still going ahead with sometime in November once the country reaches that 80% total vaccination rate, that milestone. However, it really remains to be seen how various states and territories will impact that, in particular Queensland, Western Australia and Tasmania, where they are reluctant to open their borders to anyone at this point. They've had very low case numbers, vaccination rates are not high, and they are extremely worried as to what will happen once people in particular from New South Wales, Sydney here and Melbourne start to head into that state, especially with vaccination rates so low. The federal government is hoping that last week's announcement about opening the international borders is giving the airlines and businesses plenty of time to ramp up business so that they are prepared for the expected increase in business, something the federal government is hoping will give the economy a much needed boost at this stage. Pandong?
Thank you very much and take care. Our correspondent Greg Navarro in Sydney. Meanwhile, several other countries have announced reopening plans. In Asia, Japan has agreed to loosen entry restrictions for fully vaccinated visitors. Thailand instituted a reduction in mandatory quarantine for fully vaccinated arrivals on Friday in Latin America. Chile is accepting foreign tourists with a strict entry requirement. Argentina will reopen to fully vaccinated international visitors on November the 1st. Now, for more insight into this complicated situation, let's cross live to Professor Chen Xi in New Haven, Connecticut, in the United States. He's an expert on health policy and economics at the Yale School of Public Health. Thank you very much for joining us, Professor. So it seems a little bit self-contradicting. On the one hand, the global death toll of COVID has reached 5 million, a staggering number in human history in its dealing with pandemics like this. And on the same time, many countries have plans and moves to reopen borders. Why is that?
Thanks for having me. If we look at the world, all the outbreaks are in different phases in different countries, as you were mentioning about Australia, Singapore, and many countries are having a surge, but the outbreaks may have peaked in some major countries, so very different phases. Countries are transforming from a zero COVID policy or containment approach to a more vaccine-led opening. So that's why we see a lot of surge ongoing, because more and more people are exposed to the virus as they go back to work and they go back to business. But the good news is that having endured more than 1.5 years fighting COVID-19, now we have a better understanding about the pathogen and how to mitigate the damage it inflicts. So with more and more global population get vaccinated, we also are faced with a less threat of virus mutations. We know the Delta is a very huge and a very deadly mutant. But besides, in addition to Delta, we are promising to say not as deadly and other mutants ongoing. But that being said, in the next few months, it will be the case, because we know that the world population are concentrated in the northern hemisphere, and the northern hemisphere is going to the winter, and with school reopening and with holiday season approaching, so there will be more and more chance of infection. So that being said, I think the safe and sustained reopening of the global economy and society will be determined by three things, and we have a good control of three things if we do good things. First is the vaccination rate. Some countries are doing great, and China has been vaccinated around 80% of people with 2 doses. And there's a few countries are doing great in Europe. So they are doing step-by-step reopening. For example, we can pay special attention to countries in Northern Europe, like Ireland. They are inoculating people around 90% of population with 2 doses. So we can keep a close eye on those countries which are doing good. And also the second condition is the timely reopening, timely public health measures to restrict the virus spread is the key. And the third thing is the preparedness of the healthcare system and the biomedical innovation, very much helpful to curb any new outbreaks. And we have some good news. For example, some new treatment therapeutics are coming out, which can treat patients and avoid them to go into hospital and without a large chance of casualty. So those are the things that can fasten the safe and sustained reopening. But we have to meet 3 conditions, as I was mentioning. If country open too quickly and with inadequate immunization, or with slow response to any new outbreaks, then we are still in very much a danger of another major surge in the virus outbreak.
Well, Professor, let's talk a little bit more on vaccination. Are you really optimistic, as you just mentioned, that more and more people in the world are getting vaccinated? But let's remember, the uneven distribution of COVID vaccines is still a serious challenge. It has been emphasized by the UN chief and by the WHO. Have you seen a clear way out of this?
Yeah. Indeed, efficient and equitable, I emphasize equitable distribution of vaccine is very important to the global stage, because any country, if they are in a major surge of the virus outbreak, then there's a large risk of virus mutation, which could threaten the rest of the world very, very quickly. But that side, besides vaccination, equitable and efficient vaccination campaign, conventional public health measures are still the key, like social distancing, masking, contact tracing, quarantine, are still the key to mitigate infections. And I was also mentioning the new development in the treatment in therapeutics, for example, the most recent breakthrough in the antiviral pill, which people can take at home when they are already infected with the virus. They no longer need to go to hospitals, and there's a lower risk of deaths. So those biomedical innovations are also important for those already being infected. But that said, those therapeutics and treatments are not a substitute for vaccination and public health measures, because we are talking about prevention, which is the key. We should try to avoid being infected or going to the hospitals in the first place. And the second best policy would be to treat those already being infected and avoid them to be worsened to hospitalization.
Thank you very much, Professor Chen Xi in New Haven, Connecticut. India says British nationals visiting the country will have to undergo mandatory quarantine even if they're fully vaccinated. The move is in retaliation for a similar measure taken by the UK, which doesn't recognize the India-made AstraZeneca vaccine and is making Indians vaccinated with those shots to quarantine.
The Foreign Office had indicated last week that this would be coming if the UK doesn't reverse its decision to make fully vaccinated Indian travelers to the UK quarantine. Now, from Monday, British nationals coming into India will require an RT-PCR test taken prior to departure. They will need to take one when they land at the airport in India. One would be taken on the 8th day of arrival, and of course there is a mandatory 10-day quarantine that they will be subjected to as well. And this is in line with how Indian travelers need to now get into the UK and adhere to the restrictions there. Now, India really is making a point here, because one has to remember that the Covishield vaccine is recognized by the WHO. It has been formulated in the UK itself, and India sent millions of vials of Covishield to the UK upon request. There would be many British nationals that have been vaccinated with Covishield itself, which is why the Indian government has said that this is a discriminatory measure by the UK government to impose such severe restrictions on travelers who have been double vaccinated with Covishield, and hence the reciprocal measures that are coming in now. Now, the UK government on its part has actually clarified that they do recognize Covishield, and the problem is not the vaccine. However, they say that there are some technical difficulties that they have been encountering when it comes to recognizing the Indian vaccination certificates.
US pharmaceutical company Merck says it will soon seek regulatory approval for its oral COVID-19 medication. It says the pill reduced the hospitalizations and deaths by 50% in people recently infected with the virus. If it's approved, the drug will be the first oral antiviral medication for COVID-19. Merck says it plans to make regulatory applications worldwide. Scientists have hailed it as a huge advance, but say it should complement highly effective vaccines rather than replace them. You're watching Global Watch on CGTN. Coming up,